Good afternoon, ladies and gentlemen. Before we begin, I would like to inform you that the theme around this workshop is related to child health, safety, and well-being. As Mr. David said, I am representing the Sharjah American International School in Dubai, and I am the head of the special education needs for elementary. I will share the objectives with you of this session. Our main objective is to identify best practice of policies and procedures with regards to child health, safety, and well-being in the early years. Before we begin, I would like to have an energizer activity. Please turn to your elbow partners and discuss some of the policies and procedures. One more minute. So basically, the themes in this workshop are related to Maslow's hierarchy of needs. Child health would fall under the basic needs. Child safeguarding would fall under safety needs, and well-being under social esteem needs and self-actualization. First of all, we will be starting with child health. All right, so toilet learning is a very important milestone for young children and for their parents. It is not really dependent on age, but more so on emotional readiness. Parents can definitely help their children by preparing them, getting equipment ready, scheduling frequent toilet breaks, and also not pressurizing their child. Sometimes parents may become impatient and try to push their child to be ready and to start using the toilet, but this can have a very negative effect on the child. It can make the child very anxious about toilet use, causing them to have accidents and also feelings of insecurity, self-doubt, and fear. The school can support the families by giving them information about how to handle the process of toilet learning, and also by helping some children that may have continence difficulties, such as by employing additional staff and having appropriate changing spaces, and also allowing parents to send a spare set of clothes for their children to school. Eating and drinking. It's very important for children to have very healthy eating and drinking habits, and this starts at home. Having a healthy diet helps children to grow well, to maintain a good body weight, and also for them to stay active and alert. The school plays also a very important part in educating families about this. The school should have a whole school food policy and also involve the parents and the children on guiding the food policy and the practice within the school. Now we come to bedtime routines. Children thrive with routine and consistency. And it helps with family bonding and helping the child to become emotionally well-adjusted. Parents can have bedtime routines. They can, for example, set a specific time when they start with feeding them, giving them dinner, bath time, helping them to get dressed in their pajamas, reading a book that they may like, singing a lullaby, and also tucking them in. This helps to foster a good emotional bond for the child with his or her parents. Children also, the younger children, need more hours of sleep, roughly around 9 to 11 hours of sleep. This school also can play a very important role in educating families. They can also introduce healthy sleep habits for school-ready children, and also emphasizing the need for parents to have a consistent routine and schedule for bedtime. Also giving parents tips on having a quiet, dark bedroom, not allowing them to play with digital devices like the iPad or smartphones, and also if the child wants the door open or a bedside lamp on, they can do that. Another important aspect of child health is illnesses. Children tend to develop flus and colds very often, and unfortunately, parents sometimes send their kids to school even when they have severe and persistent coughs, sneezing, diarrhea, vomiting, and fever. It's important for parents to be able to identify when the child should stay at home, especially if they have chickenpox, measles, mumps, or pink eye, which are very contagious. Now, the school as well also plays a very important role in making sure that they have qualified medical staff that are well trained. If there's a child that's sick and is sent to the medical team, it's important for the medical team to assess them, to give them appropriate medication, and if they're well after a while, to send them back to class. However, if they feel that the child is still very unwell, they need to contact the parents and make sure that the parents take the child to a medical facility, give them proper treatment, and enough time to rest and recuperate before sending them back to school. First aid. First aid is a crucial part for child safety. It's important that staff at schools are trained in first aid. They also need, the medical team needs to be able to support children with specific medical conditions such as diabetes, which is really a prevalent disease amongst people in the Middle East. Addressing specific healthcare needs of children that may have food allergies, and also supporting them with medications that they may need. Another important aspect is for the medical team to have workshops and to have activities creating awareness for staff and for teachers and for families with regards to good healthcare approaches and by maintaining confidential medical records. Finally, we come to child's eye health. It's very important for parents to check their children's eye health, especially young children. It's the parent's obligation or to take their child to the pediatrician or to the relevant eye care doctor to have them tested, because many children actually have vision impairment issues such as refractive errors, lazy eyes, squint eyes, and they may have allergic conjunctivitis. It's also very important for the school to support the families by educating them on proper diets for children that maintain eye health, informing them about certain eye diseases such as conjunctivitis, which can be very contagious, and also by educating the children about taking care while they're playing, because eye injuries are actually very common. Teachers need to be taught or need to be trained on how to recognize vision eye problems, common eye problems, and also what to do in case of an emergency if there's an injury in the classroom. Now we'll just do a quick activity. If you can please fill out the checklist for 3 minutes. Which school are you?
Reference International.
All right, so you're the counselor or?
No, I work with the young children. So.
Right, okay. If you can please turn and talk to your elbow partner about the checklist that you've just filled out. Yeah.
And then I think by September they need to be toilet trained and they need to be bathroom attendant and that is not helpful in the bathroom. So we'll talk them through what to do, but again, safeguarding the adult doesn't go in the bathroom. And that is a difference, I think, from when you're in a university setting, where you do provide that intimate care and it's expected, that is a distinguishing factor. So for us, whether we should become
So now we'll be moving on to a very sensitive topic, and it's very important, I think, for everyone to be aware that this is actually very common amongst children. And they are the most, they're the most sensitive age group of where some of this can happen. Safeguarding is the action that is taken to promote the welfare of children and to protect them from harm. Safeguarding comprises of protecting children from abuse and maltreatment, preventing harm to a child's health and development, and also providing safe and effective care. The school must have a sound child protection policy, and there should be a team that leads the child protection within the school. The school environment should be safe for children, and staff should be trained on how to identify and respond to a child that may be abused. Child abuse refers to when a parent, caregiver, or stranger, whether through their actions or failure to do so, causes injury or harm to a child. Child abuse can take many forms: physical abuse, neglect, sexual abuse, exploitation, verbal abuse, and emotional abuse. Now, physical abuse and neglect are easy to spot. You see a bruise on a child, they come to school dirty, not bathed, they look sick. You would assume it could be physical or abuse or neglect. But verbal abuse and emotional abuse is a little harder to spot. Verbal abuse and emotional abuse can vary from a parent using derogatory comments, yelling at the child, constantly breaking down their self-esteem. And this can have a very negative impact on a child's psychological health, emotional health, and on their physical health as well, leading them not to become well-adjusted adults in the future. The school support is very important when it comes to child abuse. Once again, the staff need to be trained on identifying or spotting treatment abuse of children and mistreatment. The school staff have an obligation to inform the Child Protection Agency if there is a case of abuse. And this can make a very big difference in a child's life in the future. Sexual exploitation of a child. This can happen to children below the age of 18 years old. How can you prevent this? By educating children to understand their bodies and respecting family boundaries. Developing an open and secure, trusting relationship with your students and between the teachers. Explaining the difference between safe and unsafe secrets. And teaching them to have self-respect, self-protection, and to be assertive. Many schools deal with hostile and intimidating parents. This is an issue that comes up many times. Once again, if the child has intimidating and hostile parents, the child may share this with his or her teacher, and then it would be up to the teacher to take action with regards to this. However, there should be a procedure. The teacher needs to remain calm to make the child feel secure about what they've just shared, and also to avoid interrogation directly with the parents. They need to go through the appropriate school authorities and also to work with other professionals trained on dealing with situations like this. Now, if you can please complete this activity with your elbow partner. It's a visual graphic organizer on child abuse, and if you can just fill it out, it's related to your implemented policy, practice, and procedures. Wellbeing is a very broad topic, but I will be focusing more on IEPs. There are many children in schools that may need extra support because they have learning difficulties, they might have cognitive challenges, autism, hearing impairment, visual impairment, speech or language or developmental delays. This is where the support service department play a very crucial role in helping the child. Once a teacher or a parent has a concern about a certain child, they would have or they would ask for a referral. Then the team, the IEP coordinator, the counselors would go in, they would meet with the family, observe the child, and also make several other observations in general classroom settings. Once this is done, they would form an action plan. They would refer the parents to go to a clinic to get certain assessments done. And once they have these assessments, they will create an IEP, which will focus on the child's academic goals, individual education plan, which would focus on academic goals and the social and behavior as well. Basically, an IEP involves a whole team collaboration. It's an IEP coordinator, psychologist, a classroom teacher, therapists, and also other specialists. This definitely is a very crucial aspect of a school, and it really does help a child in helping them to maintain a good academic level and also to help them to become well adjusted in school. Finally, we come to the early support for brain development. Now, whether at home or at school, it's very important for children to have regular routines and consistency. Children thrive when they have consistency, and also when they have positive and reliable supporting relationships with their primary caregivers and at school with their teachers, with the counselors, and anyone else they may be in contact with. Once again, there are certain requirements for the family and for the school to acquire knowledge about certain medical knowledge, also behavior, and for them to help their children to become healthy and well-adjusted individuals. Communicating with families and caregivers and educators, it's collaborative. Everyone needs to work together, and this is the only way that a child can actually grow and maintain a healthy psychological, emotional, and physical all-round. Building systems and connections with the community. Once again, it's collaborative. It can't just be one single person. It has to be teamwork for children to thrive and once again to grow up to be well-adjusted and healthy in the future. So thank you. Now we'll come to the best practice overview activity. If you can just think about some of the best practices of policies and procedures that your school has with regards to health, safety, and well-being. We'll take 5 minutes, then we'll just have a big discussion about these themes. Thank you very much for filling out the worksheets. We'll be collecting them and then we'll be compiling them and emailing them back to you. We have everyone's emails.